Here is your station. So if you have read and understood, considering it critical care scenario, kindly please tell me, how would you manage this patient now?
I will manage this patient according to the critical care or surgical patient.
Okay.
I will check for the I will follow the ABCD protocol.
Yes.
And I will first of all check the airway of the patient. Patient is talking to me, considering airways normal. Then I will search for the breathing pattern. The patient is breathing. Patient will come with respiratory rate. Patient is having the tachy or I will check for the saturation, and then I will assess the circulation of the patient. I'll first of all measure the blood pressure of the patient. As I can see from the stomach, the patient is having the low blood pressure. I will insert the whiteboard cannula, and side by side I will take the samples of the patient for send for routine blood samples as well as cross-match 6 units of blood, and I will start the resuscitation with the crystallites.
Okay.
Then I will manage this patient in the HDU,
Yes.
center line insertion, and as well as insertion of a urinary catheter. I will monitor this patient hourly to see the output.
Okay. This patient labs, as you can see, presents with low hemoglobin level. What do you think might be the type of anemia patient suffering from?
This patient might be suffering from microcytic hypertrophic anemia.
Okay. Do you think would it be an acute type of anemia or a chronic type of anemia, and why?
This could be an acute type of anemia if because this picture, this blood picture shows the kind of infection she is having in the body. Like like the patient is having the CRP is raised,
Yes.
acute inflammatory. This is an acute inflammatory stage due to which the patient is having the fall in the hemoglobin, and the platelet is high, and TLC is also
Why
high.
do you think platelets are elevated?
First of all, it is due to it is also acute phase reactant. That is why it is increased, and it could be due to the because of dehydration.
Okay. Dehydration, or there is probably acute bleeding going on.
Acute, yes.
Right. Can you tell me what are the differential diagnoses of diarrhea that you'll think of? Because this patient is having bloody diarrhea and has
Yes,
had 12 so what are the differential diagnoses you'll think of?
I the probable differential diagnosis would be ischemic colitis or the ulcerative inflammatory bowel disease, like ulcerative colitis or Crohn's disease, or any other infective colitis, uh, and there could be a carcinoma colon.
Yeah. And considering the age, even could be diverticular disease,
Yes, diverticulitis.
elderly. Okay. Can you please explain why the patient has low sodium and low potassium levels? What might
It
be
is
the reason behind it?
it is because of the loss in the blood.
Very
The
good.
patient is
Because of
having
the loose blood flow.
diarrhea.
Yes.
Diarrhea. Yes.
Good. Right. Right. In management, what other investigations would you do or would you carry out which hasn't been done yet?
I will search for stools for culture, and I will cytology,
Okay.
and then I will also for CEA levels, carcinoembryonic levels, then antigen levels, and also send for the antibodies for the inflammatory bowel disease,
Okay.
as well as colonoscopy in the later stages.
All right. Anything else?
And can I answer this later?
Maybe you can send it for ESR. Why is it important to know, considering the low hemoglobin, why is it important to know the ESR level of the patient? What would that signify or confirm for you?
But this is the acute inflammatory stage present or not, because in acute inflammation it would raise, so it will give an idea if there is a raised CRP and there is a raised ESR, then it is an idea that it is an acute episode of bleeding
Okay.
or
Can
because
you
of some inflammation.
tell me, you said that you'll be monitoring the patient hourly. So what are the parameters that you'll be monitoring? How would you
Uh,
follow the
I'll,
patient? Yes.
I will monitor the patient, monitor the cardiac index, and looking for peripheral warmth of the patient, and urine output of the patient, as well as vitals, checking the blood pressure and the pulse of this patient and saturation of the patient.
If in this situation you do an image like the one you are seeing in front of you, how would you interpret this?
Uh, this is a dilated, the picture is showing a dilated bone with thumbprinting sign,
Okay.
and it is because of the inflammation or thickening of the hosta present in the colon.
Yes.
It looks like a thumb, that is why it is giving a thumb imprinting.
Yes.
And there is a dilatation of ascending as well as a transverse and colon.
Yes. This kind of imaging is what what kind of decision this kind of image is trying or making you to make?
It could be due to ischemic colitis.
Yes, but then you'll think of surgical intervention.
Uh, uh, yes, the patient may require like a subtotal colectomy if the patient is require any surgical intervention, or the other intervention may be a subtotal colectomy with ileostomy, or the raised pan-proctocolectomy
Yeah, most likely.
with ileostomy. Yes.
So one could be toxic megacolon. What other indication could there be?
Other indication will be persistent bleeding, not able
Yes,
to control with the medical management,
yes,
and there is a perforation and there is a obstruction,
yes, yeah,
and that's
yeah. That's most likely okay.
for yes, that's it. Near to like
All right. Why do you think patient has high, okay, urea creatinine? How would you comment on that? Patients.
it's on
Urea.
the in the high, it's on the higher side because urea is on the normal
Yeah.
range, but creatinine,
Or maybe dehydration shows signifies dehydration. What about the
yes,
creatinine? How much it should be? Normal creatinine level?
it is up to 1.6, but this is I think millimoles. This is written in millimoles, so I'm not able to understand this value in millimoles.
Okay, good. Thank you.